The patients usually come with loss in vision in one eye, sudden onset of unilateral loss in vision in one eye, and it's usually painless also. So in one of the videos I discussed about central retinal artery occlusion, branch retinal artery occlusion. This time it was a vein occlusion which happens in the retina. So let me quickly show you the picture of the retina first. And here you can see the picture of the retina that we took in the office today. There's a little glare on top, but I'm going to eliminate that. So here you can see the retina, and you see this is the optic nerve. I'll make it a little bit bigger. And you see all these bleeding areas here. That's very classic for central retinal vein occlusion. Again, it happened only in one eye. And these are the bleeding areas you can see in the central part of the retina. So that's a CRVO. And then I'm going to show you the macula also, what the macula looks like in this case. And here you see this is the left eye macula and this is the right eye macula. If you look at that, that's pretty intense. You see all the edema here in the macula. And then this eye is perfectly normal. You see the normal looking macula. And then let me compare it to the last time this patient was here, which was just in November. And if you compare the macular finding, look at this. This is the macula from November last year, from 2020, left eye, right eye. And then again, comparing it to today's, look at that, drastic change in the left eye. And I was trying to find a fundus photo to compare it with. Let me see if I have something to show you guys. Probably you don't have the fundus photo from before, but definitely this is the right eye fundus, which is the retina showing the bleeding areas. And then the left eye, if you look, is fine. I mean, see a little bit of asteroid hyalosis, which is a different condition, which is maybe calcium deposition. But again, going to the retina, this is right eye and this is the autofluorescence, and you can see the bleeding in that. Anytime we do the autofluorescence, you can see the bleeding pattern in there as well. So that's central retinal vein occlusion, and the important thing is to send them to the retina specialist right away, and we have Dr. Blem as our retina specialist. So I contacted him right away. A lot of times he will put the patients on Alphagan, which is to lower the pressure down, which is 3 times a day. It's a drop. And also, if they're not already on a baby aspirin, we can ask them to use a baby aspirin. And then a lot of times Dr. Blem or the retina specialist is going to probably do injection in the macula, in the retina, to decrease the edema. Okay, so read about central retinal vein occlusion and come to your eye care provider, eye specialist. Take care. Have a good weekend. Bye-bye.